I'm so excited, guys, to be back. We're bringing Dr. Radhika Sharma in again to talk through what we didn't get to last time. We talked about sex, we talked about vaginas, we talked about dryness, all of the things that nobody wants to talk about. Like all the things that were like, I don't know who to ask. Do I ask my friend? Is she going to think I'm weird? Do I ask my mom? No, that's weird. Like, who do I ask? I don't even want to ask my doctor because, listen, I have taken some of these things to the doctor's office and I feel so uncomfortable asking my OB. I don't know why. It's just not a thing that we like to really talk about. So we're talking about all those things. We're going to get to today the questions that we did not get to last time. So real quick, I'm going to reintroduce her if you were not on that live. Um, and if you weren't, you should go watch it. It's so good. Okay, so Radhika Sharma is a dedicated OBGYN certified wellness coach and co-host of the Double Scrub podcast. I want to be on that podcast. Passionate about women's health, workplace wellness, and preventing burnout. She's spoken at numerous events and podcasts, delivering engaging, relatable, and thought-provoking talks that inspire action. She is a co-author of Thriving After Burnout. Oh, I get it. I think I said the same thing last time I read her bio. And has been featured in Fabulous Wisconsin for her expertise in health and wellness, with a special interest in nutrition, lifespan health, and overall well-being. She empowers individuals of all ages to take charge of their health and find balance in their personal and professional lives. Gosh, I love her. She's so great. Known for her authentic storytelling and ability to connect, which we all saw. She brings both medical expertise and real world experience to every stage, not day, that's a stage she steps on, whether discussing burnout recovery, wellness strategies, or the power of self-care. She leaves audiences feeling motivated, informed, and ready to take the next step in their journey. Ladies, and maybe a gentleman or two, Dr. Radhika Sharma. Hey, you're here. Oh, yeah.
Hello. Hi again.
Oh, we are back.
So excited.
So there's so many good questions. First of all, thank you for doing this again.
Yeah, it is so wonderful. I mean, I love it. I love it. I
I
love the
know.
interest. I love answering questions. I love empowering women. And I wish I could be physically there with you.
I know. Well, one of these days, like we discussed after your last live, you'll be coming out here doing my podcast. I'm
Oh,
so
I
excited
can't
about
wait.
that.
And absolutely, we would love to have you on our podcast as well.
As well. I'm so excited. I'm
Yeah,
so excited. Thank you.
absolutely. Yeah.
Okay, so I'm going to dive right in, and I'm going to dive right in by asking you a question about me.
Yeah. Yeah. Tell me.
Okay, so listen, and this might be helpful for some of you guys, and you all who have had this procedure done, let me know. And I know we already talked about it. There are many women on this live, like in this group, who have had what I had last Monday, which is the LEAP procedure.
Yeah.
So can you explain the LEAP procedure for anyone who doesn't know what we're talking about, like what it is?
Yeah, so the LEAP procedure is essentially we use a loop electrocautery, and all that means, big words, is we take a device to remove cells from your cervix that we're concerned about. So women get pap smears depending on your age, depending on what your history of pap smears have shown. You get a pap smear anywhere from yearly to every 5 years. And if it shows something that's abnormal, we take a biopsy of it. And if it says, hey, look, there's a moderate or high grade abnormality, then we can do this procedure called the LEAP procedure. The LEAP procedure usually is done in the office, but depending on the patient, sometimes we can do it also in the operating room. And
Yeah.
essentially what we do is, it's just like doing a pelvic exam. We put the speculum in, we get a good view of your cervix. Sometimes we give you some pain control depending. And then we essentially remove a portion of the cervix through a loop that actually burns and slices at the same time. And the goal is to try to get this piece of cervix off in kind of all together so we can send it off to the pathologist and say, hey, look, did we get all of the cells off of this person's cervix? And, how bad actually was it?
Yeah. Yeah. Okay, because so they first had me scheduled in office,
Yeah,
and they called the day of, and they're like, "Wait, hold on, we're looking. We need to schedule operating room
sure.
and put you out." So
Okay.
I did that, right?
Yeah.
And
Yeah.
so they like I was very light with my movement last week. So this is a week and a day ago. And they
Yeah.
essentially said if you like the first few days, I didn't bleed. I spotted a little bit,
Sure.
but probably day 5 I have not stopped. Maybe day 4. The
Okay.
bleeding has just continued, and I'm not on my period. I had my period before I went in,
Yeah.
ended, like, right
Yeah.
before. Could it trigger a period? Like, so I'm going back in because 'cause they're like, "Yeah, you shouldn't be bleeding like this." It is red. Red,
Yeah.
and
Like,
it's
not a period red.
no. Yeah, like I
Mhm.
was saying, it's like I cut my arm and I'm patting it,
Yeah.
and it's not stopping. So I'm also like, is it because I'm doing fish oil? So whatever's happening, but like it's
You're
constant
not
all
on
day.
anything, and I would say, like, if you're on a blood thinner or something, then we'd be a little bit more concerned, but I don't believe you are. Um,
No.
so I think that, like, yeah, we usually when I have someone who has a LEEP procedure, I tell them light activity for, like, 7 days.
Okay.
And part of the reason I say that is because if you're lifting something heavy, the cervix actually has a lot of vascularity or a lot of blood flow to it. So it's kind of like if you had a stitch after having a baby and you
Got
were
it.
like doing something too early and then you popped a stitch and it started bleeding. So it's very
Yeah.
possible that you had like a little vessel that was kind of starting to clot off. And then did you do something? Maybe. Sometimes it's not even doing something though, because I hate to put the onus or the burden on the patient and be like, "Did you do
Yeah.
something?" Like, I don't know, not everybody. Some people literally come in. I remember seeing someone come in at 3 days after a LEEP procedure, and they were like filling up a pad every 1 to 2 hours. I was like, "Yeah, no, it's nothing you did." She's like, "I didn't do
Yeah.
anything." Like, it's just, some
Yeah,
people
that's kind of me, right? And it's been like that for days. So I'm like, am I bleeding internally and I need to go get this?
unlikely, which is yay. Which is
Okay, good.
good.
So I'm
'Cause if
gonna be
you're bleeding
fine.
internally, I think you'd be
Yeah.
pretty sick, but I'm glad that it's, that you're going to get it addressed.
Yeah. Yeah. I my follow-up appointment is Friday, and they're like, no, we need you in today. So they could get me in at 1:30. So I'm as soon as we're done, I'm heading in there to go get it
Yeah,
checked out.
perfect.
But I'm probably fine, right? I'm good.
Oh, yeah, and
Okay.
honestly, we have some really good in-office stuff that we can use that even if it's like a small blood vessel, we
Yeah.
can put it on there and stop it from bleeding.
Okay, good. Okay, I feel better. I feel so much
Yeah,
better. Thank
that's
you.
that's what we're here for. That's what we do. We try to, like, alleviate the really, that's what an OB/GYN should do.
Yes, make me feel okay.
Yeah, yeah,
Thank
it
you.
should.
How perfect that we had this live right
I
before
know.
I was freaking out right before
Timing.
this. Doctor, so like you're carrying me through this hour.
Oh,
Thank you.
yeah, you'll probably just go in and be like, "Okay, that's I feel better now."
Good. Okay, so I feel like we should jump right in because I'm looking and we have a
Okay,
lot of questions on hormones. There's
good.
questions on pelvic floor health,
Yeah,
PCOS,
yeah,
thyroid could also be up in here, perimenopause. Okay, I'm just gonna start. Maybe
go for
we're gonna, oh my gosh, there are so many. We're gonna try and do rapid
it.
fire. Okay. We're gonna like,
Okay, we can do rapid fire.
but some of them might be the same. So let me just start.
That's okay.
I'm not gonna say the name of the people who you'll know. I see
Okay,
actually this person is on here.
okay,
So this person said, I had a hysterectomy in 2019 at 39 due to uterine fibroids. In 2022, I had to have my left ovary removed due to ovarian torsion. Should I be
okay.
getting my hormones checked? I also have PCOS and I've always struggled with weight.
Uh-huh. Yep, and so I would say, do you need to get your hormone levels checked? Not necessarily. No. However, if you're, and I think just to confirm that this person is 39 now, if you're starting, like, this is the time that women start having perimenopausal symptoms.
I
So
think
the
she's
fact
45 now. So she's
you 45
45.
now.
This was
Oh
20.
yeah, so you're
Yeah.
in the thick of it. Like, you
Yeah.
are in the thick of it. So you don't have a uterus anymore, which that kind of helps in one part of PCOS. PCOS, also polycystic ovary syndrome, for people who don't know what it is, it can be considered what's called a metabolic syndrome, meaning it can have effect on your glucose regulation, as well as weight gain, as well as your fertility. So people with PCOS can struggle with a lot of these things. If you feel like the weight is becoming an issue, it is possible that it is hormone related for sure. Do you have to check those hormones? No, but I do encourage you to see a provider to say, look, am I a candidate for hormone replacement? Or shouldn't say hormone replacement because you still have one ovary. Hormone therapy, because you're not necessarily in menopause, but you might be in the perimenopausal or menopausal transition, and you could benefit from hormones. That doesn't mean you have to check your hormone levels.
Okay. Okay. I'm actually going to skip down because I like that she brought up PCOS.
Yeah,
Uh, and I have a couple questions, but I'm going to I'll read both of these so we can kind of see. These are on
sure,
PCOS because we're talking, you just brought that up and you said
sure.
it's metabolic syndrome.
Yeah,
One person wanted to know tips for losing weight with PCOS. And then the next person said, question, I was recently diagnosed with PCOS and endometriosis. I take SLYND.
Slind. Mm-hmm. Yep.
And a low dose of metformin, which has helped a lot. I no longer have a period, and most of my symptoms have disappeared. I used to avoid medication, and I leaned more toward holistic approaches. But
Yeah.
after years of struggling and not knowing what's going on, I finally decided to choose these treatments. I'm curious,
Okay.
what are your thoughts on these types of medications for PCOS and endometriosis? And do you take a specific approach when helping patients manage symptoms like less facial hair or bloating in the lower belly area, even when pain is no longer present? So she has two questions, but let's just
Yeah.
stop there. I feel like PCOS. So tips around that, however you want to, wherever you want to go from here.
Yeah, so polycystic ovary syndrome, I think so the fact that when you have polycystic ovary syndrome, what can happen, and it's funny because historically, I think this has been changed, not literature-wise, but there was like skinny PCOS and not skinny PCOS, which doesn't mean a thing.
Okay.
All it means is that we used to think that if a woman was overweight or obese, she would be more likely to have polycystic ovary syndrome. We are finding that that's not true. We are finding that women of all sizes can have polycystic ovary syndrome. Now, having said that, when you have polycystic ovary syndrome, it is an endocrine issue. And there's several hormones in our endocrine system that are regulated by estrogen, progesterone, testosterone, cortisol. And I talk about that a lot because with women with polycystic ovary syndrome, it's like completely out of whack. So when
Uh,
you're put on something like Slind or progesterone, the whole idea is to keep the lining of your uterus thin because often women with polycystic ovary syndrome don't have regular cycles. So that's number one. Great that you're not having a cycle at all. I think it's probably because you're on continuous Slind.
okay.
The metformin can be helpful in women with polycystic ovary syndrome if there is concern for insulin resistance because they can go hand in hand. And if you have insulin resistance, meaning your cells in the body are not becoming more sensitized to glucose, your body's going to keep making you have higher levels of glucose in your blood, which in turn can lead to weight gain and difficulty losing weight. So I totally appreciate the holistic approach. I think it's very important. I think the fact that she's in your group is super helpful because not even the endometriosis part, but the polycystic ovary syndrome and the insulin resistance is going to improve with weight management,
Okay.
strength training, steps, all of that.
So I love that everything you just talked about kind of puts together a puzzle piece. I mean, I don't know that I knew that much about it 15 years ago when we were starting the TV show, but
Yeah.
when one of the girls in season one,
Yeah.
maybe she was season two, but regardless, we were help. It was 2010 that we started working with her.
Yeah.
She had PCOS, and
Mhm.
she couldn't have babies. She had been trying for years and years.
Yeah. Yeah.
We took a carb cycling approach for everybody on
Mhm.
the show.
Mhm.
And what we realized, I don't even think we knew it was going to help, but what we realized was that her carb cycling, which, yes, she was losing weight, but the doctor had said her being on carb cycling was beneficial for PCOS. Do you know, does that make, is it because of the insulin sensitivity kind
So
of?
part of it is like, I mean, and this is the hard thing, right? With nutrition. There's this whole idea, and like I feel like a generation of people that like carbs were bad, right? And I know
Yeah,
we talk about like, no, our body actually needs carbs because
yeah,
carbs will break down to glucose and the type of carb you eat and things like that. The idea is figuring out what type of carbs your body thrives on. And I remember I even spoke to someone in the fitness industry, nutrition industry years ago, and she said some people will thrive on certain carbs and others won't. But the whole idea is by changing kind of, as you said, carb cycling and changing the way you eat carbs,
yeah.
that will change the sensitization of your body and the way your body processes glucose, which
Wow.
will in turn affect weight gain for
I
sure.
love that. Yeah, she ended up, losing a lot of weight in a very
Yeah.
healthy and maybe, I mean, it was pretty fast because on the
Yeah.
show, but her journey after and how she maintained was really beautiful. Ended up
Yeah.
she, had tried for 10 years to get pregnant. After
Yeah.
the show, she ended up giving birth to 2 babies.
Oh, that's so
Yeah,
cool. And
got pregnant like that.
I see that a lot.
Yeah.
There is like unexplained infertility in polycystic ovary syndrome. However, we also find sometimes like if you have polycystic ovary syndrome, and in this person's case, you said I think she's 45 now, or if that's a different person. But if someone is trying to conceive and they have polycystic ovary syndrome and they are overweight, one of the first things I'll say, and it's a difficult conversation to have, it's not something that we want to hear necessarily because we're already feeling so vulnerable about wanting to have a baby, but it's like lose the weight. And what's crazy is our body learns to ovulate again, or to
Wow.
essentially it changes all the mechanics in our body. And we see these women get pregnant much more quickly.
Ah, I love that. Okay, that was so helpful. Uh,
Good.
People are loving your answers. So I'm going to give this next question that Stacia had too. She said, "I also have a fibroid, and while my doctors have said it's likely benign, they've recommended removing it. I don't feel any pain, but I do notice that my lower belly seems a bit inflamed. What are your thoughts on fibroids? How do they typically affect the uterus, and how do you decide when removal is really necessary? Thanks for your time and sharing your knowledge."
Yeah, absolutely. Happy to do so. I see women with fibroids in the office all the time, like every single day. And so fibroids are characterized as three different types. I won't get too technical, but I will say there's fibroids that are inside the uterus. There's fibroids. So let me just say this. The uterus is a muscle. Fibroids is not muscular tissue. It's just tissue built up, kind of like if you've seen people with like fatty deposits underneath their skin called lipomas.
Mhm.
They're completely benign. Most fibroids, not all, 1% of fibroids are not benign or
Okay.
not. So, anyways,
Okay.
three types of fibroids: inside the uterus, in the wall of the uterus, and outside the uterus. The conversation usually is depending on the person's desire to keep their uterus, if they want to have children in the future, and if it's affecting their life. Meaning, often women with fibroids will have more or heavier bleeding, or their bleeding will be more times throughout the month. If that happens and someone's done having children, the option is removal of the fibroid or removal of the uterus. So that's the conversation I have. And I really say, I think the most important thing with patients is saying, what are your goals of therapy? For this person in particular, if you're having kind of discomfort around your cycle, often women will have pain with intercourse, things like that, then I'm going to say, look, like it's giving, or if it's
Yeah.
growing, then I'm like, get it out. Get
Yeah.
it.
So then is that a thing? It's more elective because you're just trying to make your life a little more comfortable kind of a thing. You don't want to bleed all the time. What
If
or
you're anemic, if you're anemic or bleeding like all the
yeah,
time, I would
that's
not say elective. I would say like, or if you're
okay.
having pain with intercourse or pain, some women will have pain with urination or feel like they have to pee all the time, or several other symptoms. And depending on what it looks like on the ultrasound and your examination, we might be like, look, it's affecting your quality of life. So if it's affecting your quality of life or your ability to exercise or makes you fatigued throughout different times of the month, that's something to consider as well.
Okay. How big is a fibroid? I'm so curious about this.
Depending. Oh,
Yeah.
I've seen fibroids as small as like a centimeter by a centimeter,
Okay.
and I've seen fibroids as big as like 18 to 25 centimeters. Oh yeah.
Wow. Okay, so
Yeah.
because when you said pain with sex,
Oh,
And
yeah.
is it because of this? Because there's something in there that's caught, it's like block what?
Well, if you think about a uterus like that, I should almost have a uterus back here, right?
I know. We have a
Sorry.
little rubber uterus.
If you think of a uterus like that, and
Yeah.
there's like a little size of a golf ball or a ping
Okay.
pong ball on top, and if you're having sex and deep penetrative sex, there's like something bouncing around on the top. If it's on the inside, then there's something on the inside. A lot of women with fibroids will say, I feel like I'm bloated around the time of my period, and then when I start bleeding, it is like a hose, like it won't
Oh,
stop. And so, yeah, then we get concerned. If it grows really big, like the size of a cantaloupe, which it can, then it's pressing on your bladder. And women will say, like, I have to pee like all the time because the amount of urine or the amount of pee that can be
yeah.
in your bladder is really low.
Okay, so now I'm thinking of another question, which
Yeah.
maybe, so you're saying like I'd never had pain with sex
Yeah.
until, and it wasn't like a size thing. I mean, not that I'm not saying it
No, we
wasn't.
talked about this even last time. We did. We talked about, I mean, listen, I never had a problem either. I am now 41 years old and I'm like, what the heck? This
Well,
is
it was
crazy.
like, this is a while ago, but like it was like in my right, almost like where the right ovary was.
Mhm. And depending on where you are in your cycle, you have, cysts that form, and
Mhm.
they can actually and
First.
that's normal. They can burst, or they can be, you can feel them.
Okay, so it must have been because I also have had ultrasounds where they're like, "Oh, you have cysts over here. Are you about to ovulate or whatever?" And
Yeah.
so maybe during that time, but it was always on the right side.
And honestly, like, I think that, it's interesting. You mentioned something in the introduction, how like we just don't always feel comfortable talking. And
Yeah.
I just,
Yeah.
it
Like
makes
I
me
would never bring
emotional,
that up
it
tonight.
makes me sad because, and I did a when my husband and I did a podcast, like, last week, we did it on a really sensitive topic, and
Yeah.
I'm like, it makes me really emotional when I think about the thousands of women out there that don't feel comfortable to come into our office and, you know
Yeah. And so then I sit there and analyze, like I've actually thought through this in my mind because when that was happening, I do take it back. I ended up going to the doctor
Yeah,
because I was having pain on the right side.
yeah.
But it was so hard for me to say I'm having pain during sex. So then I
Mhm.
was like, is this like a shame thing? Because culturally or religiously, how I was that I don't want to admit, I'm not married. I don't have a wedding ring. Just all of these thoughts go through my
Oh,
mind,
it's
you
like,
know?
and it's like, how many it was really funny. I was listening to a podcast earlier, and they're like, if what happened to a woman at the age of like 48 or 52, meaning like their tissue starts getting thin and dry and they
Yeah.
can't have sex, happened to a man, like meaning their penis shriveled up and essentially they couldn't have sex anymore, we would have like all of Pfizer creating a vaccine that men would start taking at like 45 to make sure that, you know what I mean? So
They're
I think
not hard
part
enough
of
and
it,
they just take a pill and they're fine.
yes,
You know what
and
I'm
I
saying?
think
Like, let's make it harder.
part of it is just like, yes, it's breaking through this shame. It's the fact that so many of these, like,
Yeah.
you know what else makes me sad? And I wonder if people in your community can relate to this, but like people will be like, but I love my OBGYN, but I love them. They're the best. And I'm like, awesome. And they're like, but I just can't talk to them about this. And I'm just like,
I
I
know.
don't, and again, my job is not to just sit here and be like, but you hear yourself? Like, I'm not going to do that because I'm not going to
No.
shame you for feeling that way by any means.
Yeah.
But I almost want to say, like, if you don't feel comfortable, you maybe need to ask yourself, like, why?
Yeah, it's almost like saying, like, "But I love this boyfriend, but I can't
Yeah,
change who I am, and I can't talk
yeah.
about anything with them." You're like, "Wait, what are you doing?" And I've been
And
there.
he has no idea what my favorite color is. Slime.
Fun. I don't think he knows what color my eyes are.
Yeah,
Yeah.
exactly, exactly. Yeah, yeah, yeah.
Oh, okay. I love that. Can you remind me too, because you just brought that up, which then has me thinking, I'm sure a lot of women watching are like, okay, how can I find an OBGYN in my area or get support in that way? What's the name of your platform again?
So it's called Seva Wellness, and we have a QR code. I think Alyssa has it, and we can repost
Okay,
it again.
yeah.
But
Yep.
essentially, if you reach out, essentially, if you fill out the intake form, tell us what you're looking for, tell us where you are. If you're looking for a provider or you're looking to help, sometimes I'm saying even like help answer some initial questions. We do that,
Okay.
and then figure out who you can get in touch with. The other option is to go to the Menopause Society, and I
Okay.
think it's menopause.org. Caveat with that is not everybody is
In menopause.
or doing the same thing,
Oh,
right?
got
So,
it.
like,
Okay.
every menopause provider is not gonna
Okay.
be like an every obstetrician. Like, every obstetrician delivers babies. That's what they do,
Yeah.
right?
Yeah.
Every menopause provider, some of them might be like, "Hey, look, I do this," and the other one might so they're not all, I should say, created equally.
Yeah, I got it. They all have different backgrounds or specialties or whatever that go with it.
Right,
I love
right.
that. And you guys, we will post that because I know like that's something you all want and need. I
Yeah.
saw a comment. I just want to read this. Jessica said, "We need more doctors like Dr. Sharma because my doctor doesn't make it comfortable and relates everything back to my weight."
Oh, I'm sorry. And part of that, Jessica, is because and this is no excuse,
Yeah.
okay? Your doctor doesn't know. I mean, there's an entire society to talk about, like, obesity medicine, essentially, and even if it is related to your weight, we have to be like, we're here to help you. That's our job to figure out,
Yeah.
like, okay, how do we tap into this to make you feel better? Like,
Yeah.
the answer is not just, "Well, go ahead and try to lose weight." Cool. Maybe you've been trying to do that for years and you can't do it. Like, we have to come up with a solution for you.
I love that. So also they're asking if we can maybe potentially get a link in case they can't do a QR code. Can
Yeah.
Okay, we'll put that in the
I'll give it
post.
to Alyssa.
Okay, cool. Cool, cool.
Okay.
Good. Thank you.
Yeah.
Okay, so the next question, we're going to go back to hormones. This person said, I had a hysterectomy, but still have ovaries. 57 years old, and I had no kids. I've been getting up every 2 hours at night to void the last few months. What's that?
Going
Maybe.
pee.
Oh, okay. I'm not a doctor. I
What
don't
I'm
void
here
my
for.
own
What
baby.
I'm here for. That's good. But you know what? Do you know why people probably love you? I'm not even kidding, Heidi. Is like you don't claim to know everything that they're
Anything.
yeah.
Literally anything. I don't know anything.
It's good that people appreciate that. It's honest.
Okay, so she's voiding at night. Now I totally know
She's
what void.
urinating at night,
I'm
and
gonna
she has
yeah,
hysterectomy, and she has both ovaries, and she's
yeah.
57 years old. Okay.
Yeah, and good job. Then she said she tried vaginal estrogen cream, but it was way too messy. Now trying estradiol tablet insertion, but it's still happening. Any other
Uh-huh.
things to stop waking up every 2 hours?
Mhm. Okay, so several things to consider. There are multiple different types of estrogen. There's estrogen cream, like you've tried, the estrogen tablet. There's a string, there's
Mhm,
a ring, there's
mhm.
Eva Mist, which you can actually spray on your skin. There are patches. There are numerous different options. Um, don't give up and look for another type that will work for you. Also, one thing I like to say about vaginal estrogen is stay the course, especially at 57. Often, when people will start vaginal estrogen, they'll start to have yeast infections or they'll start to have some weird discharge. All
Okay.
that is your body returning back to a normal
Mhm.
pH because it was very basic before. So you might have like a yeast infection. Stay the course. Keep working on the tablet. The other option is, and the American Urologic Society just came out with guidelines that you can use other things. You can use topical testosterone. You can use something that's known as DHEAS. There's lots of different options um, than just the tablet.
Hmm.
Mhm.
So
So
what
even like going back, if you're like, hey, I want to stick with it,
yeah,
go back to your doctor and say, like, this is not working. Can we come up with something else? And if they say,
I
look, I
love that.
don't know, then we got to find you somebody else.
Then go to, her platform and find someone
Yeah.
else.
Yeah, for
I like
sure.
that. If a
Yeah.
doctor doesn't know and is, like, saying, "I don't wanna figure it out," that's, you
Yeah.
can't yeah, find
Because
someone
the number of times a day that I'll say, I don't know, but I'll figure it out for you
yeah,
all the time.
yeah,
And to me, that's like the challenge of my job. If I knew all the answers, like life would be boring,
I
right? Like that would be
know.
boring. It would just be repetitive. So
Yeah. Okay, I love that. Thank you. Okay, the next person, this person says this is Renee's question. It's not a very personal question, so I'll say your name. What type of specialist should someone see that is working to balance their hormones?
mm. Renee, yes. So you want to see, you would ideally like to see a I'm not going to say an OBGYN, a gynecologist
Mhm.
who is familiar with perimenopause and menopause. It's going to depend on your age for sure. And then also it depends on when we say balance hormones, I just want to educate it for like kind of like correct
Yeah.
the idea of balance hormones. Our hormones do this,
All the
okay?
time.
All the time.
Yeah.
So the idea is to optimize your hormones. So if you are
Mm.
in menopause, it would be optimizing your estrogen or your progesterone. If you are in, um, let's say you're someone who's not even in perimenopause, let's say you're in your early 30s, it might be like, hey, I'm looking for hormone regulation with combined oral contraceptive. So like an estrogen and progesterone or the standard birth control.
Oh, I love that. I like, and this kind of leads into the next question. This person said, it's a longer question, but she says, what's the right way to ask my doctor to check my hormones? I almost feel like optimize my hormones. You just said that word,
But
but
I will say, like, so back in the day, we used to say, absolutely not. We're not checking your hormones, right? And I kind of touched on this even in the last one. I think that that is archaic and it's paternalistic and it's old school. I
yeah,
think if a man wanted to come in and check his T, we're not going to say no. So I'm
no,
not going to say no if a woman, I
yeah,
just had a patient on Monday. I don't know what day it is. Today's
I don't
Tuesday.
even know.
You know,
Whatever.
Monday
Yesterday.
come in and she's like, I want to talk about, I can feel my body changing. 39 years old. I can feel my body changing. I'd like to check my hormones. And I said,
Mm,
cool. What are your goals? What are we wanting to look at? I said, I will absolutely look at your hormones. But if you are still having a regular cycle and you're not having certain symptoms, we may not gain much information from checking them. But if you say to me, Dr. Sharma, I don't care, I want to look at them anyways, I'm not going to say no to you. Because
yeah.
then if we do end up treating you, then we can see, look, how are the hormone levels fluctuating based on our treatment?
Yeah, because I've had my hormones checked a lot. I've done a lot of panels for different things as I was
Yeah,
troubleshooting, and I like completely attest to the reality that my estrogen one time is going to be 250 and then it's going to be 59 and that it's all over the
yeah.
place. I did this thing called the Dutch test. Are you familiar with the Dutch test?
It sounds familiar,
Oh,
but I don't.
it was a naturopathic doctor. It was really fascinating to me.
Yeah,
But you have to do the Dutch test because of this. So the person was explaining all these other tests you're getting done don't matter. Kind of a like it's a snapshot at a point in time and you're going to treat something here that like it's not whatever. They're not saying when was your period and they know your cycle. So the Dutch test, I believe it's like a 2-day test
okay.
and you take it on a certain day of your cycle based on how long your cycle is. There's a guide. And then you cut out all caffeine. You have certain times that you urinate on test
Yeah,
strips. It was the most, I feel like I should send you the results that I got so you can see
yeah,
how broken down it was. It talks,
yeah.
I mean, it was the most comprehensive hormone
Mhm.
analysis that essentially says everything's fine, right? Because
Yeah,
it's like actually getting a clear picture of what's happening in your body. But it broke down the 3 different kinds of estrogen and how your body is methylating each of them and which one's in a danger zone or whatever it was. It was really
yeah.
cool.
Sounds very
Yeah.
interesting. Yeah.
Yeah. Okay. Random, just random little.
No, it's fine. That's what I'm
So the next part of this question is okay, we might have to do rapid fire. When I because we have so many. When I asked that, okay, she said she asked for hormones, they test thyroid and that's it. But I feel like there's more to be examining for any imbalances. There has to be more, right? And it's my PCP GY my gyno that runs the blood test to check my hormones. She's 34 and her mom went through menopause at 40, so she's just curious.
Oh, yeah. So if your
Yeah.
mom went through menopause at 40, truly menopause, she was premature menopause, which means she was early.
Yeah.
So I would actually say if your primary care is a gynecologist, say, look, I'm concerned because if your mom had premature menopause, this means that we would have wanted her to be getting hormone replacement. Because if your estrogen falls off before the age of 45, that actually increases your cardiac risk factors, your risk of bone health, issues with recurrent urinary tract infections, bacterial infections. So if you're 34 years old, I would say, yeah, absolutely. You want to have certain levels checked because now you're like, I'm trying to make sure I don't miss something. Like,
That's a really important, I didn't know that. So if
super
your
important.
estrogen drops before 45, you're at higher risk.
Yeah, and it's not just, like, little things. It's like, some people will ask me like, "Oh, are you taking her ovaries out? She's, like, 49, she's 52, she's 54."
Yeah.
There is data that still supports that the ovaries, by leaving them in until the age of 60,
Mm.
60
Mm.
will decrease all-cause mortality by 10 years, meaning it can take 10 years off of someone's life.
Wow.
This is where, like, it's really sad because we spent so little time understanding this in women, and, like, there's generations of women who are, like, my mom's age, who's are in their 70s, who are, like, they've been mistreated for, like, 20 years.
Yeah. Wow, that is that's really fascinating. So
Yeah.
now I'm like, man, I want to make sure I have a handle on where my estrogen is as I approach 45. So
Mhm.
then someone said to piggyback on Jessica's question, what level should be checked and how often?
So I wouldn't say it's an often thing. I would say it's really symptom based. If you have that risk factor, like of that person with her mom, I would say checking it yearly could be useful.
Okay.
I would say levels can be checked if your symptoms start getting worse. So if a woman at the age of 39 starts having really bad hot flashes, if your cycles go completely out of whack, if your vagina feels like the Sahara Desert, if
Yeah.
you feel like you're having heart palpitations, sorry,
Yeah, but I've
Patience.
been there.
If your if you feel like you're having heart palpitations, like, yeah, check your stuff out because
Okay.
I wanna make sure you're not at a super high risk.
Okay, I love that. Okay, so this one said thoughts on HRT. My doc kept me on birth control to ease into menopause. I'm assuming that means I would not want to supplement with more HRT. The process is confusing to me, and I've been gaining weight like never before. Plus, I'm hungry all the time, hoping to find a way through perimenopause without gaining loads more weight.
Um, Birth control pills are, super physiologic levels of hormones, meaning for a transition into estrogen or sorry, into menopause, we wouldn't give you those dosages of estrogen and
Okay.
progesterone. We would probably give you a patch or something like a cream um, that can kind of get absorbed systemically, but it's a lower level than the estrogen and progesterone in a combined birth control. That is a very historic idea. Doctors have been doing it for ever, but we know it's not necessarily the right thing to do. So I would almost say get off of the birth control pill. See if you can, based on your symptoms, should you go on something else?
I love that. Okay. Okay. We're going to go to the next one. This person says breast cancer survivor here, 21 years, just at the time when Women's Health Initiative story about HRT broke. So estrogen replacement therapy was never an option for me. What can I do now to mitigate the damage done to bone, heart, and brain health due to lack of estrogen while enduring an early menopause? Is it safe to request estradiol now?
Vaginal estrogen, 100%. You absolutely can. Systemic estrogen is going to be based on the type of cancer, but through shared decision making. And if you're having symptoms, then it can be safe under the correct guidance.
Wow. Okay. So good. Okay. I'm going to scroll down a little bit and go into
Yeah.
menopause, if that's okay.
Yeah.
No, here we
You're
go.
fine.
This person says, I'm just starting to experience perimenopause symptoms. I'm interested in learning more about HRT. So we may have already gone through this and how to correctly use it in conjunction with my thyroid meds. When is the right time? My amazing endocrinologist just ordered a hormone blood test and I will be getting results shortly. Are there numbers to look for, or is it more about symptoms? Right now, they're fairly mild, but if I can avoid them getting worse, I'm all for it.
So I think it's great that your endocrinologist decided to order a panel. I think that that's awesome. There are specific numbers, but we often will treat symptoms. It's my hope that your endocrinologist will be comfortable talking to you about like a transdermal estrogen and
Mm.
progesterone if you have a uterus that kind of you can balance in conjunction with your thyroid medication. I will say it sounds like the person you're seeing has a pretty good handle on things. So that's awesome.
I love it. Okay, next question. I'm 44. I've been using IUDs for the last 7 years since my daughter was born. Should I use a different birth control so I can get a period again? So I can notice when my period changes? Because from what I've read, that's a big sign of perimenopause.
No.
Keep it.
Yeah,
Okay,
IUDs are the best, like,
really? Okay, good.
they are amazing. So,
Okay,
yeah,
great.
don't worry about you can replace it when you get to your 8-year mark, but
Yeah.
otherwise, no.
Okay, keep. Okay, next one. How do we know if we're in perimenopause? My doctor seems to think I'm not in it yet, but I'm 46, but I for sure have a lot of symptoms. What do I even say to my doctor to get them to consider this?
I'm in perimenopause.
Yeah.
If you can't help me, can you send me to someone who can?
Yeah.
You know, I like I think that it's getting to the point where women have to start advocating for themselves
Yeah.
and like, I need something. Like I'm having the brain fog, I'm having the joint pain, I feel tired all the time. Like, what is going on? Someone check my vitamin D level, someone check my calcium level, check my hormones if I feel like I need it. Let's
Yeah.
talk about, okay, can we at least try some topical estrogen and see if I feel any better? Like, I don't want an antidepressant, I want something else.
Yeah.
If you can't help me, then can we see someone who can?
Yeah, that's I was gonna say, what do I say to my doctor to get them to consider this? I wouldn't say anything. I go find another doctor. Okay. Next one says, I'm 43 with early signs of perimenopause. Actually, is that early sign or is that? Oh, early sign. Okay. I also have endometriosis. So hormones are a huge problem for me. My doctor's been having me use an IUD to help with pain of endometriosis and ease my way through menopause. I don't know which foods I should eat and what type of workouts are good. I work out 2 hours a day, 5 days a week with little results. I'm sure it's what I eat, even though I feel like I'm relatively healthy. I want to know if I'm eating the wrong type of healthy foods. I know with endometriosis, I have to be careful on what type of foods I eat.
So that's a really good, so here's the thing. Our bodies turn into like an inflammatory or a swelling state when we're in perimenopause. And Heidi can probably speak to this, huge from the fitness industry. If you're doing 2 hours of work, you
Mhm.
might be doing the wrong type of 2 hours, because 30 to 40 minutes of the directed, targeted exercises 3 to 5 times a week is going to be better than exercising 2 hours a day. Your body is likely in an I was in this situation a year ago, and I changed the way I worked out, and I dropped 12 pounds in, like, like, consistently in 4 months, and I was like, I was the woman who was doing all the high intensity interval training. I was in the hot yoga scalp classes. I was running, I was doing cardio and weights, but my body was in an inflammatory state. It could not keep up. I was not giving myself enough appropriate nutrition. And so, yeah, I wasn't losing weight. So it's probably a combination. I'm not saying stop working out. I'm not saying that by any means. I'm
Yeah.
saying the type of workouts and potentially what you're eating is probably affecting it. High
Yeah.
protein, minimal processed food, clean eating, lots of fluid, flushing all of that inflammation out. Super important.
I feel
Roughly,
like this is a good
Heidi
thing.
said, steps, like, huge,
Yeah.
huge.
Sure. Well, and this, Alyssa, maybe you want to take this question and throw it on Thursday's live, and I can address and help you guys figure it out because there are things to do but yes, 2 hours a day, 5 days a week. That's a lot. It makes sense though that your body's not losing weight.
Mhm.
Okay, next one. This is funny because you've texted me about this. I haven't even told you my answer. What kind of creatine is best for perimenopause if you're going to take every day? I take the brand that you asked me about. I have it in my cabinet right
Guess
now.
what I just did, you take a Thorn?
Yeah.
So do you know what's really exciting that
What?
I get to share with you guys, like, pretty much first? About 2 weeks ago, Thorne reached out to me, and they want me to offer the dispensary to people like my followers, my clients. So it was, like, the coolest thing because I've been using Thorne creatine for 2 years, maybe 2.5. I've been using their protein for the better part of 4 years. I use their, like, I'm using their magnesium.
Yep.
So what's really cool about Thorne, and again, obviously,
I
like,
love Thorne.
this
A,
is
a
my
lot of
disclaimer.
their products I use.
Yeah, this is my disclaimer because
Yeah.
now I do need to tell you guys, like, I'm going to, be a I have a proprietary,
Hashtag brand partnership.
essentially
Yeah.
essentially a proprietary pharmacy with them is what they
Oh,
created, a dispensary, which is amazing. And they're like, "Well, if you offer it for discounts, then you're gonna get less." I was like, "I don't care. I want people to take it." For me, it's more important that people take it because this is going to help their overall longevity, you know what I mean? So I was
oh,
like, "What can I offer?" Anyways, I will
I love that.
keep you posted, and please,
Hey, thank
share
you.
people posted.
So
But
if they want to order? Can they reach out to you and figure out how to
Absolutely.
order?
So I'm gonna
Okay,
end up putting it on, probably on my Instagram for sure.
I'll grab it
But
so
I'll
they
make
can order.
sure, I send it to Alyssa, I send it to you because
Okay,
yes, you'll be able to get a percentage off.
amazing. You guys, this is, oh, it's right here on my counter.
Yeah.
This is
It's
it.
the best. It's the best.
It is. It
And
really
yes,
is.
I will say, I've said this before, supplements, vitamins, all of it. Here's the thing with Thorne, their level of scientific testing is insane.
Yeah,
Like
yeah.
it's so beautiful. And now what they're trying to do is probably one of the reasons they reached out to me is because they're trying to make the people who are promoting it to be doctors. Like they're trying to make it docs because they want to be like, look, it's supported by science.
I
I'm
love
like,
that.
I want you to send me your data because I want to
Yeah.
read it. If I'm
Oh,
saying like take it, now I've been
mm,
taking it, but I'm like, I need to be able to, support it.
I love that. Okay, good. Yay.
Yes. So
Thorn.
take Thorn.
I-
Absolutely. And I will definitely have a discount code. I'll let you guys know.
Okay,
When.
good. Thank you. Yeah, we'll put that in your thing.
Yeah.
Okay, we're gonna do rapid fire again for a few more. Now we're on to menopause.
Okay.
Should menopausal women do intermittent fasting?
Oh, that's a very good question. So our bodies are very different than
Yeah.
men's. And I would say there's not a lot of good data to support intermittent fasting in menopausal women.
Okay, good to
So
know.
I wouldn't.
Don't do it for that purpose.
Right.
Okay. Next one. We keep hearing that it's more difficult to lose weight after menopause. What can we do to help ourselves lose weight after menopause? Is there something we can do differently at this age versus younger, or are we just stuck struggling?
Absolutely not. Absolutely not stuck struggling. I'm sure Heidi's talked about this before. Follow your macros. Figure out the amount of protein you're getting. If you're getting 60 to 80 grams a day, it's not enough. More than likely, you're looking at like
Love
85
it.
to 100. I mean, I take 135 milligrams or 135 grams a day. It's a lot.
Same.
But
Yeah.
strength training, strength training, strength training, uh,
Yay.
rucking, I
Yes.
understand that you might like running. Running's working against you. I'm sorry, it is. Nutrition, don't limit yourself. And I think you said something so important. You were eating In and Out the other day,
Yeah.
and you were like, "This is not a treat meal. This is a
Yeah.
meal, and it's
Yeah.
okay." Like,
Yes.
give yourself the nutrition, set yourself up for the success through lifestyle changes, so you can keep eating In and Out. Don't stop eating In and Out because you're in menopause.
I
Absolutely not.
love this. I love it. Okay, such good
I
advice.
also don't
I
have In
love
and Out
it.
where I am, and I love it. So
Oh, when you come to do my podcast, we'll do
yeah,
now for sure.
yeah, absolutely.
Okay. Next question. Is menopause belly real? And if so, is there anything we can do about it? Thanks in advance.
Menopause belly is not like a scientific term, but yes, so the redistribution of fat in our body goes to central adiposity or menopause belly. So by eating foods that help decrease inflammation, meaning lots of green leafy vegetables. I talked about I did a reel just yesterday on like the mind diet, which is important for brain health, but also can target that central adiposity. Steps, water, water,
Okay.
water. Our bodies process alcohol differently. I still drink alcohol, but I'll tell you, it processes differently.
Okay, good to know. So good. Okay. Being surgically placed into menopause over 10 years ago, now 45. How much does estrogen
Go get some
testosterone?
hormones.
Okay, yeah, there we go. Get hormones.
If you've been
Okay.
menopausal for 10 years and you're 45 years old, please find
Mm,
some. Yes,
okay.
please.
Okay. In addition, hypothyroidism, I was on T4, T3. My levels were off, so currently holding the levothyroxine.
You're holding it. Okay, that's fine.
Yeah. Okay. Cool. Next one. I'm in menopause 6 years and I take Cymbalta, taking for 6 months. Is that right? Are both or either of these my problem for not losing weight for the last 5 months? Have never had this problem before. And if so, what do I do to fix it? Is there anything different in eating workouts that should be done in each stage of these groups, perimenopause, menopause, postmenopause, or is all information the same for each?
No, definitely different.
Okay.
Especially as we get older, your metabolic rate will slow down.
Okay.
You essentially need to trick your metabolic rate to staying high. And to do that, it's going to be like, I mean, the challenges that you're doing are amazing because, at 60, rucking is really important for the health of the joints, but also you're doing weighted walking. So you're not running, you're doing a weighted vest walk, which I think is really important to help with that basal metabolic rate. And then also the strength training is super important, lifting heavy, appropriate form, um,
Okay.
starting with small bites and or small workouts and working up.
Okay, we're thinking about in and out, small bites. We're still
Still eaten in and
yeah.
out. Yeah.
Okay, there are more questions, but we're gonna get through menopause because I don't want anyone to feel left out here, and I think this is so important, and
Yep.
then we'll wrap it up.
Okay.
Uh, I'm postmenopausal. Is depression common at this stage? I started with antidepressants a few years ago, and it's been so difficult to lose weight. What helps lose weight and belly bloat? So, is depression
Yeah.
common? And then
Yeah. So 35 to 50% of women in perimenopause and menopause have increased depressive symptoms. They feel like it's so upsetting. So it's going to be a combination of therapy for sure. Antidepressants is fine. Some antidepressants can affect weight, but not all of them. And then I think I'm going to harp on it. If you're a candidate for hormone replacement therapy, it is something to consider. I just started a woman who was in perimenopause, who felt like she was going crazy, couldn't sleep, and was getting really badly depressed on estrogen and progesterone. And she's like, I actually feel better. You
it's the
know,
best. Like me going on progesterone has been amazing. Hold on, it's beeping. Okay, thank you. I love that. Next one. This I think we already know the answer to this, but there might be more to add. How to deal with menopause symptoms, aches, pains, digestive issues, belly bloat, fatigue, even after 9 hours of sleep each night. She says, should I be taking hormones? My doctor doesn't seem educated on this. So number one, go to your site so they can find a doctor that is. But then what else do you have to add to that?
I would say if you're sleeping 9 hours a night, making sure that you have like a comprehensive look at like what's your vitamin D level like. If you live in Arizona, your vitamin D levels are probably okay. What's your calcium like? Getting hormones checked is completely reasonable. If you are a candidate for hormone replacement therapy or hormone therapy, depending on your age, getting on hormone therapy is an option. Looking at it as a multidisciplinary approach is like so important.
I love it. Okay, thank you. Thank you. Last question. And then what I'm going to suggest, I'm going to gather the questions that we didn't get to. I'm going to get with you and see how we might be able to get answers for those. Is that
Absolutely.
okay?
Yeah, and then what I did also last time, with you, and I've done it with people before, is
Okay.
like I do an ask me anything too. So I try to do an ask me anything on Instagram. I try to answer as many questions as I possibly can. And then, we go from there. But I'd love to like allow your community to continue to
Yeah.
have access as well.
Oh, so awesome. Okay, so I'll get
Yeah.
you all the questions so you have them all, and then we can decide how you want to. Yeah.
Yeah.
Okay,
Because
cool.
we're gonna be doing something. So
Yes, exactly. We are.
yeah.
Okay, the final question. This person says, I'm 61. I was blessed with very mild periods my whole life, not one single menstrual cramp or anything. When I was around 46, I had one last period that lasted an entire month. I went on Pravira for a week or so. Then my period shut off like a light switch. I've never had one menopause symptom ever, even with no symptoms ever, no body changes, no abnormal pap, no hot flashes, none of the things. Is your body still going to act menopausal when trying to lose weight if you haven't had any signs?
Yes.
Okay.
Yeah. The
Yes.
answer is yes, because you've now I think it's wonderful. You're one of the most blessed human beings to have none of the symptoms. That's awesome. But the losing weight is going to be part of A, just chronologic aging, and B, it could very well be because your body's lacking estrogen. That doesn't mean you necessarily need hormone replacement, but you could benefit from probably altering your diet, altering the way you're exercising, things like that.
Got it. I love it. So many good questions answered. Thank
Absolutely.
you
Yeah.
so much. I went a little bit over. I got
You're
to get
welcome.
to my doctor now.
Go to your
I
doctor.
I really appreciate you. And to everyone watching, thank you for being here. I know that there were more questions that came through. Um, so we'll try and gather all of them. I'll get with you. We'll figure out what's
Absolutely. We gotta do some stuff.
I
Absolutely.
know.
I feel like we're
Well, thank
changing
you.
the world one
I
woman at a
know.
time.
Yeah,
Fun.
we
Perfect.
are. Thank you. I really
Yeah.
appreciate you.
And
I'll
I hope
voice
your
memo
doctor's
you in the
appointment goes
car.
well.
Thank
Keep me
you.
posted.
Hey, thank you. And bye,
All right.
guys.
Take care.